just wanted to have a very candid and a very factual conversation with you as to what a simple doctor like myself perceives to be the present situation amongst this flood of disease that is washing us out of the present frame of time. You see, once we seemed to have got over the first blast of COVID sometime in about beginning to the mid of November 2020, I think both the people and the government became terribly, terribly complacent. From the part of the people like you and me, whenever we relax, whenever we get half a chance, it is almost a human instinct, it is not a criminal instinct, that humanity has flourished on this natural behavioral urge to get together. So we start getting together in big gatherings. There is this thing called the big Indian wedding, which is now expressing itself as the great Indian folly. And all these things in various cities, towns, urban, rural locations, after being imprisoned for a period of 3.5 months, suddenly we were like bird out of cages and we were completely unrestrained in our normal behavior. But that normal behavior seemed to have been thoroughly abnormal given the situation that this virus was still very much lurking in society. It was just waiting for an opportunity to raise its head. And like the people, the government was not far behind. And for any kind of government in India, the biggest addiction is an addiction to power politics. The government got terribly distracted in planning its territorial acquisitions in the forthcoming state election. It was back to its own designing and scheming ways, given to all kind of campaigning and propaganda, both real time and virtual. And we will be entirely wrong to put every blame on the sort of quarters of the central government. The state government in every principal state was equally to blame. What did we not do? So the practice of epidemiology, public health, preventive medicine, in this period of our frolic and relief took a backseat. We took our eyes off the ball. We did not go on doing a kind of antibody surveys, random sampling of the population to see that what was the level of this slumbering infection in society. We did not do adequate public health analysis as to whether there were some funny strains and funny genomes which were growing in different parts of our country. So some of us, and sadly it included very high people like the Health Minister of India, numerous chief ministers of our states, who went on making very bold and triumphalistic public statements that as far as India was concerned, we have conquered COVID and the story of COVID is behind us. As it is said in medicine, that you should never announce an early victory without having the proper antidote in hand. And so far, as all of you know, that scientists are breaking their heads on the wall, but so far we have not come across a very effective antiviral as yet. But the only difference was that by about October it became very clear that significant advances were made in vaccine development and some vaccine or the other will be with us. all of us know all the names by heart by this stage. The Oxford AstraZeneca vaccine, the Moderna, the Pfizer, India's own Covaxin, Sputnik from Russia, and many others. There was a few glitches as far as giving the appropriate compliance and permissions to vaccines were concerned. And all in all, once the government starts relaxing, that's a very bad sign. So the government could have been a little bit more proactive and given permission to vaccines sometime in December 2020. There were a whole lot of bureaucratic concerns and bureaucratic fine print being sorted out, and this took the process of giving permission to vaccines, the Oxford or the AstraZeneca and the Covaxin, to 2nd of January 2021. That, in my mind, was a bit too late. We were the only country in the world who, by destiny, were given the opportunity to start vaccinating at the falling phase of the pandemic. We squandered that opportunity. When vaccination finally started in 16th of January, you see the first phase, which was focused on doctors and other healthcare workers, we were very, very slow. Doctors were perhaps the most skeptical group of all the people put together. And in the first month, we really struggled to meet up. We were not even at 50% of our target. Because, mind you, the public health planners of India, quite correctly so, had set ourselves a target that by July 2021, we needed to vaccinate about 30 crore population, which means 60 crore doses. Because if we do so, and if we presume that 25% of the population were in some way or the other exposed to the first wave of the infection, then the two put together gives us the very elusive, but at the same time, the very important herd immunity to protect ourselves from subsequent attacks from the virus. There is a myth going around in people that the second wave is inevitable as the first wave, then there will be a third wave, then there will be a fourth wave. No, that is not the idea. The best way to prevent a second wave would have been not to have the first wave at all. Look at the countries of Southeast Asia, what is otherwise called the Buddhist belt. Look at countries like Thailand, Cambodia, Vietnam, Japan, South Korea. Look at China itself. All these countries with a fast public health reflex, with a strong preventive health machinery, they did not even let the first wave happen. A country that where most of us have been to, Thailand, which appears to be a bit of a relaxed, lackadaisical, vacationing kind of destination. Even Thailand did absolutely brilliantly as far as minimizing the first experience of the virus was concerned. So if you consider the period of time, the entire phase from January 2020 to December 2020, you add all the Southeast Asian countries together they did not even have 200 lives lost. China itself had one spike in Wuhan and then very little after that. So what did China do? It's a big country, it has many provinces. So whenever Chinese would anticipate that the virus was raising its head in some part or the other, they would go on and their entire machinery of the people and the public health systems put together would test, would isolate and separate that province from the rest of the country. So preventing another Hubei, Wuhan-like experience, because once you allow the infection to come to a big city, it spreads to the rest of the area, to the rest of the states, to the rest of the country in no time. And that is exactly what happened in our second wave. We got more than a month's notice that this was rearing its head in the districts around Nasik in Maharashtra. But both the state and the center was really, really relaxed. It allowed the infection to get to the big cities of Mumbai and Pune, and anything that gets into Mumbai in India will inevitably spread to the rest of the country in no time. The rest of the story, the rest of the drama of the real hardship and disaster is still going on. It is there in front of our eyes. And the moot point that we try to tell you at the moment is a couple of things. Number one, needless to say that things like wearing a mask whenever we are out of our very known and small circles, the cleanliness, distancing, sanitization will all have to be maintained. The second important thing is that whenever, it's a very sad fact, I can tell you the story later, that our people in high places have not done very well as far as organizing our vaccination is concerned. So it picks up one day, it slows down the other, and that goes on happening. But whatever happens, ladies and gentlemen, please get yourself, everybody you know, everybody around you, including the people who work for you, who help you, no matter how simple and how ordinary they look, each one of them needs to get vaccinated at the first possible opportunity. Whether it is Covishield, whether it is Covaxin, whether it is Sputnik in a few weeks' time, it does not matter at all. So precautions along with vaccination is the only way that we can get out of this mess. And we as doctors, we are terribly overworked, overstressed at this point of time. Because the way the infection is growing, probably West Bengal, even with its electioneering and rallies and everything, that could have been best avoided. But even at this point of time, we are a little bit, a shade better than say a Delhi or a Mumbai, than a Maharashtra or a Delhi. Because all in all, this time around, the second wave has been about 5 to 7 times bigger and higher than the first wave. And this current disease burden threatens, or perhaps if we are honest, has probably already overwhelmed our healthcare capacity. Maybe in the weeks to come, the government will be forced to think of a lockdown again. The lockdown, you see, I am not a very pro-lockdown person. A lockdown never eradicates infection. But this time, I think, as a part of the medical fraternity, we are pleading for some severe restrictions to come in, because that is the only way we can preserve the what remains of our healthcare infrastructure. Because under this big pressure of what's happening now, if the basic healthcare infrastructure gets destroyed and destabilized, we have nothing left in hand with which we can fight this pandemic, because this will probably go on for at least another month and a half to 2 months. And the way you and I, everybody, whether we are a medical or a non-medical person, can help to get these ferocious level of this viral pandemic down is once again by ensuring that we are safe and the people around are safe. This has not been the first pandemic of the world. There were the 1880s and the 1890s, when India was repeatedly exposed to either plagues or cholera. There used to be an epidemic almost every 1 or 2 years. How many pandemics there were, we don't know, but we certainly know there was 100 years before. And in one of those experiences, I think this happened sometime in 1890, that even Swamiji, who had just started his mission of setting up Belur Mott, had acquired the land. He was so upset, he was so shaken by the experience of cholera pandemic in Kolkata that he was rushing out to sell off the piece of land he has acquired in Belur for the Mott and mission. He was stopped by Srima, and Srima told him that he must not deviate from what he set out to do, and God and Thakur will look after the fact that give him the resources and the blessings that were necessary for that brave young man to face up to the pandemic in his time and in his own era. So all of us who profess to believe in that ideology also have a small mission in front of us. And that small mission is to take care of the environment around you and me, to look after the people. We have to go on spreading the word of positivism, because it is only with our collective efforts, our honesty and our sincerity, with the blessings of these great people who walked the earth before us, that we are going to emerge from this challenge. God bless us. Our pranam to Thakur, to Srima, to Swamiji, to our Guruji, Swami Gitananda Ji,